Welcome to our webinar, Putting Adult Learning Theory into Practice. My name is Kendra Farrow and I am a certified vision rehabilitation therapist. For 14 years, I provided services to individuals who were blind or vision impaired. Since that time, I have been providing training and technical assistance to professionals all across the country who provide similar services. Through these interactions and experiences, I have learned a lot of different things about service provision, how to motivate consumers, how to make sure they have the information they need to set the goals that they really want to work on, and so forth. I am hoping that the information in today's presentation will give you some new ideas and maybe even some new tools to put in your toolbox. Let's start by talking about learning styles. There are a number of different learning styles, and the reason we want to start with this is we want to think about what learning style we prefer personally. The reason this is important is because we tend to default to teach in the same way that we prefer to learn. And if we have a client, a consumer, who wants to learn or needs to learn in a slightly different way, we're going to have to adjust that default setting of ours. So I have a chart here that shows circles, and within each circle is a short definition. I'm going to read through the different types of learning styles. Solitary. You like to work alone. You use self-study and prefer your own company when learning. Social. You like to learn new things as a part of a group. Explaining your understanding to a group helps you learn. Logical or mathematical. Learning is easier for you if you use logic, reasoning, systems, and sequences. Verbal. Words are your strong point. You prefer to use words both verbally and in writing. Visual. You prefer to use pictures, diagrams, images, and spatial understanding to help you learn. Auditory. You prefer using sounds or music or even rhythms to help you learn. Physical or kinesthetic. You use your hands, body, and senses to help you learn. You might even act out something as part of the learning process. Combination. Your learning style is two or more of these different learning styles. I believe that one of the keys to providing quality services to individuals with vision loss is to remember that each person is an individual. We want to strive to provide services that are individualized to each person's needs. And there's a lot of ways that, although our consumers have some similarities, they're also very different from each other and in different combinations. They each have their unique needs, and those things can be because they have differing levels of vision, they have different living situations, they have personal preferences, they have different resources available to them, and they might have different family support or just support from other people in general. And I'm sure there's some things I didn't think of on my list, but these all contribute to the individualized nature of each individual we serve. And if we don't take that into account when we approach them, it is to their detriment. We don't want to just have this template for services that we try to make each person fit into. Oh, welcome to services. You're blind. You get a talking clock. You get a Bowline pad of paper. You get a 20/20 pen. These are things that some programs, they have this kind of system, and everyone who comes through gets X, Y, and Z. and it doesn't matter their level of vision loss or that they might already have 10 pads of bold line paper. So we want to be really careful as we think about this, that we approach each person as an individual with their own set of needs and circumstances that we need to assess. We can individualize services by adapting our instruction for learning styles that are not our default style. As an example, I'm going to talk about how we instruct someone to change the batteries in their magnifier. For a visual learner, they're going to want to visually look at the button that opens the battery compartment. They're going to want to look at the grooves and the battery compartment itself, the springs. If they can't visually see it, they're going to want to feel it. It's possible that they might want to put it under their video magnifier to magnify it and look at it more carefully. It just depends on each person as to their level of comfort and their visual abilities. If they are an auditory learner, you can verbally give them the steps that they're going to need and some tips for doing it. And then you might have them repeat back the steps they're doing as they're doing the activity. For someone who likes to learn on their own, you might give them the batteries and the magnifier and suggest that they take a stab at doing it and that you're there to help them if they get stuck. For individuals who like to learn in a group, you might go through the activity with them one time and then have them do a presentation for you on how they're going to change their batteries. Let them verbally describe each step as they go through their little presentation. For an individual who's a kinesthetic learner, they're going to learn most from the actual manipulation of opening and closing the battery door and inserting the batteries. Keep the verbal instruction to a minimum or keep it just as they approach each step. So for the first step, opening the battery door, you explain how it's going to open. Let them do that step, then talk about the batteries and the positioning of the batteries. Let them insert the batteries and then talk about the closing of the battery door. One of the things that is important for us as professionals to do is to take a moment to reflect on what we're doing. This is something that I did not do enough when I was a direct service provider. I would just rush from activity to activity, from task to task, and not give myself a chance to think about, is my client learning the things I'm hoping that they're learning? Are they learning as quickly as I expected them to learn? What's working well? What's not working well? How could I improve what I'm doing? It's surprising, but I believe that just taking a few minutes to reflect on things like this will help us to adjust the things that we do and learn from what we're doing to make them better for the next individual we serve. One of the big wake-up moments to me as a direct service provider after the fact, when I came to this position, was that I had time to think about what I had done. And in reflecting, I realized that I had done some things that worked out really, really well, and yet because I hadn't taken time to reflect on them, I never repeated those activities that could have been beneficial to additional individuals. But because I didn't recognize the fact that it was such a successful strategy, I never tried it again. So it can also stop us from going down a rabbit trail into doing something that is not being beneficial and that we could improve on. So some things I'd like us to reflect about right now are thinking about the individualized nature of what we do. Do the individuals we serve generally get the same devices, or are the devices they're receiving individualized to their needs? Are the skills and the things that we teach, are we teaching them in the same way? Are we always teaching the same kind of skills? Or do we adapt each of those lessons to the individuals that we're providing those services to? And lastly, let's think about the goals that we write for the individuals we serve, or with the individuals we serve. It should be actually a group activity, and we'll talk about that here as part of adult learning theory. It should be a collaborative thing we do between us and the individual. Are the goals really individualized, or do we just copy and paste from a set list of goals that we're always using? Do we personalize them to what the individual really wants to do? Now we're going to move into talking specifically a little bit of review about adult learning theory. And many of you may have studied this when you were in school or taken a course from our continuing education offerings on the topic of adult learning theory. But we just want to have some base level information here before we jump in. First of all, adults do not learn in the same way that children do. Adults have different motivations for wanting to learn things. And lastly, we as professionals want to use the practices that get best results. So for all of these reasons, it is important that we think about adult learning theory and try to incorporate its principles into our practice of providing services. Malcolm Knowles is the individual who has pioneered the field of adult learning theory, or sometimes called andragogy. He has several principles that he's put forward in his writings on the topic that we're going to talk about. I'd like to kind of start with our second point on the slide, is that adult learning utilizes knowledge and life experiences. And I think this is really the key thing, and especially as individuals get older. So a 50-year-old is not going to have as much knowledge and life experience as the individual who's 85 years old. And when we work with adults, they have these differing levels of experiences and start at different places, which makes their learning very different from how we approach children. When we put children in a classroom, they don't have a lot of background, or we know exactly how much experience and knowledge they have because they've passed the previous grade. So they're all at a similar level and can receive the information at a similar experience level where it's relevant to what they need to learn next. With adults, because they come from these differing levels of background in their knowledge and life experience, it would be hard to put them in a classroom and teach them using a curriculum that is standardized for a topic. And because of this, the first adult learning principle on this list is that adult learners are self-directed and autonomous in their learning. So we tend to individualize the instruction that we provide for them. Some experiences that adults have as learners in their past are positive, or they can also be negative. I remember working with one adult who had some really bad experiences learning Braille, where it wasn't presented in maybe the learning style that she preferred, and it just became very, very frustrating for her. And maybe she just wasn't at a place where she was able to accept it. But nevertheless, as her vision deteriorated as she aged, she was really struggling to read print, even with a video magnifier, and yet she was totally closed off to the idea of Braille because of those previous learning experiences that she had. So sometimes it's a positive when we're building on those experiences, and sometimes it's a negative. The next three principles on our list, I feel, kind of go together. So the first one is that adult learners tend to be goal-oriented. The next one is that they are relevancy-oriented. And the third one is that adult learning highlights practicality. And I think that adults know what they want to learn because of the practical nature and the relevant nature of what they want to learn. And so that's what makes them really focused on a specific goal. I've burned myself on the stove. That's my life experience, and I know that that's not a healthy thing. So I want to learn how to do it safely because I really want to cook, but I don't want to be burning myself on the stove. The last learning principle is that adult learning encourages collaboration. So whether that's collaboration with peers or family, it can look different in different situations. And one thing that I think this might particularly relate to is individuals who come from backgrounds where their culture values the group more strongly than the individual. And I think of times when I went into someone's home to provide services and their 10 family members were all present, which felt a little bit intimidating to me from my cultural perspective to have 10 people in that session. However, it was really important to collaborate and to use that collaboration among the family group to help the individual, because that was more important to them. To have pulled them out and to have individualized it for them would have been more frustrating. So I think using that collaboration is something that can be really relevant, especially when we're looking at other cultural values that may not be ours. I believe that adult learning principles can be incorporated throughout the service process. We often think of the instruction piece of what we do as professionals, but I believe that we can also incorporate adult learning principles into assessment, goal setting, and case closure. I believe that one of the most important things we can do with assessment is to be a good listener. Listening is so important because it helps our consumer to feel valued as a person. And when we use good listening skills, we're using some of the adult learning principles that we're trying to highlight in our session today. A traditional assessment, or the default that we might go into, is reading a list of things that we have checkboxes and just asking questions like, are you having difficulty reading? Are you having difficulty using the stove? And these kind of template assessment forms that we use make people feel not very special. They know that we're just reading off of that form. And the problem is that they're closed-ended questions, and they can promote somebody only giving a one-word answer, yes or no, and not a lot of detail to really help us to think about the motivations behind, why they might want to learn. But if we ask more open-ended questions, we can learn about their knowledge, their life experiences, and how that's going to contribute to their potential goals. So for instance, instead of saying, do you have difficulty reading? We might say, tell me about some of your recent reading experiences. And then we might ask a follow-up question, like, what frustrations or difficulties did you have? And so this opens the door for them to really tell us about what kinds of reading activities they're trying to do, and maybe some things about things they might have missed doing in the past. If they say, well, I don't read anymore, then I would follow up with a question like, well, before you lost vision, what kinds of things did you enjoy reading, or did you need to be able to read? Because that often opens the door for sharing those things as well. Another example, so instead of saying, are you having difficulty using the stove? We might say, what types of dishes do you typically like to cook? And maybe as a follow-up, what difficulties have you had when you're preparing those dishes? So in this way, again, we open the door with some open-ended questions, and we're looking for what are their experiences. What is their knowledge about cooking? Are they just using the microwave? Do they like to cook from scratch? These are some of the things that can help us with the motivation. Everyone needs to eat, so it's something that usually is motivational to people to be able to prepare that food independently and and maybe the food that they want to eat, because their family members, if they're helping them, may not want to prepare the same things that the individual themselves would like to prepare and eat. This gives us a lot of information that is very helpful for the motivation behind why they might want to do this. And the motivation is so important for setting that goal and for getting our foot in the door to a more complex set of skills than just, let me put some dots on your microwave so you can warm up the leftovers your daughter is bringing over for you, or to heat those freezer meals that have been purchased from the store. We can foster consumer choice by informing them about the possibilities. Our consumers come with preconceived ideas about what someone with a vision impairment or blindness can achieve. This is really a barrier to much of what we do. However, by planting the seeds, by informing them of the possibilities, we can start to get them motivated and prepare them for possibly being interested in learning some of the additional skills that they may not have come to us originally thinking might be a goal for them. So even when an individual says to us, well, my daughter does that for me, blah, 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 we've all heard this, we can say, well, I have helped other consumers to do this thing, XYZ, shown them the adaptive skills and techniques to be successful. Would it be okay if I showed you some of those just for your consideration? It doesn't mean that you need to use them, but just so that you can know about them. I'd like to at least show you what a check guide looks like, or show you some large print options, or let's see if your magnifier would help you be able to read the print on this item or that one. When we plant seeds, it sometimes takes time. We can't expect the person to instantly change their mind, especially when they have that preconceived notion that an individual with vision impairment can't do it, and that it's been there, that they've believed that for a long time, that they've had that misconception. So we need to be patient. If we just simply say, well, I could show you that if you would be interested. Sometimes that's all we need to say. And then wait, and then come back in the next lesson, in the next month, sometime in a couple months later, and say, well, we've completed the goals that you said you wanted to work on. And I just had made a note to myself that you have your daughter helping you with this, but I wanted to just revisit it and say, you know, are you at all interested in seeing some of these techniques or strategies for doing this task? Although I have created separate slides for assessment, for informing the consumer about the possibilities, and now setting goals, it does not necessarily mean that these activities will happen at separate appointments. They could all happen at the same appointment, although spreading them out does give more opportunity for the consumer to process the information and to let those seeds germinate and possibly grow into the point where they're open to a wider range of goals than they may have been on that first appointment. However it happens for you at your agency, you want to start the goal setting process by first reviewing your notes from the assessment and providing the consumer a list of the different instructional topics that you could provide them. These might be things like looking at magnification to see what kind of magnifiers or magnification devices might be used to access printed material. It might include organizing your medications, taking more control over the management of the health conditions. It could be safety in the kitchen, using appliances, all kinds of things that we would have on the list. And if you are a mobility instructor and not a vision rehab therapist like me, it could be things like traveling around your neighborhood and then progressing on to traveling through lighted intersections and using public transportation. So it just depends on the discipline that you're providing services under as to what those options might look like. Once we've provided that list to the individual, we want to make this part of the goal setting self-directed. We want to give them the opportunity to select from that list of what things they want to work on. Do they want to work on all of them? Do they only want to pick 2 or 3 of them to start with? What do they feel comfortable doing? This is a partnership between us and the consumer. It's not us making the goals for them. It's a joint activity between the two of us. So once they have selected which goals they would like to work on, we then want to ask them to prioritize the goals. And this is especially important when we provide itinerant services and may not be able to come really frequently to work with them, and that services might be spread out over a long period of time. Which of the goals that they decided to work on, which one is of highest priority to them? Which one will help them to feel safer or help them with some of the concerns they have about safety? We want to make sure that we give them the tools for the things that are most critical in their mind first. And this speaks to the relevancy and to the goal-oriented nature of our adult learners. And lastly, we want to leave the door open in case they want to change their goals. This is kind of similar to what we talked about before with informing them and planting the seeds that might grow. So as they gain skill and see what we can provide them as a professional, they may become more open later to changing goals, to adding on to goals. So we want to leave that door open and not say, well, just because you said you're not interested in that today, that doesn't mean I'm not going to review that again with you before we close your case, because if you change your mind, that's fine. We can absolutely work on that as well. So that will help them to feel like we're not abandoning that particular opportunity, but that they can still have that option on the table even though they're not ready to commit to it today. Instruction is the culmination of the service process. We have built up to it through our processes of assessment, informing the individual of the possibilities, and then setting the goals. Through this process, we've built rapport and trust with the individual so that they're ready to accept the new information that we're providing to them through instruction. First, consider the amount and the pace of the information that's being provided. So the amount is how much new information is being provided in one session. I've seen, and I have personally provided services where I try to fit as much into one appointment as possible. So packing in a number of new topics in a very short session of 60 to 90 minutes, for instance, or even just allowing the appointment to go as long as necessary to cover all of the information. These marathon appointments are probably not the best way to be providing new information to someone who's older. As I age, I realize just how overwhelming that must feel to them. As a younger person, it wasn't as obvious to me that that might not be the best strategy. The pace of the information is not just how quickly are we providing it during the appointment, but how frequently can we provide instructional appointments. Instead of having one appointment once a month, can we provide one appointment once a week, or maybe even more than once a week? and then keeping the amount of information, new information that we're providing to a fairly focused topic and not spreading it over a lot of different things that can be lost over time, especially when we pack it all together in one session. The caseload size and the geography that we need to cover as service providers sometimes causes us to want to go to the longer appointments and to fit as much as we can into them. But think about the fact that we may need to repeat some of the instruction more times if we're giving a lot of it at one time or not allowing for repetition within the same appointment. Consider also if it's possible to provide one maybe 30-minute lesson with an hour lunch break in the middle, and then coming back for another 30-minute session where you repeat some of the same information that was provided in the first 30-minute session. In this way, the individual will be able to hopefully absorb and not need as many repetitions to integrate that new strategy or device into their daily life. Also, offer to repeat things. So asking about review when you come on the next time. Would you like to review this? How is it going? Have you been able to integrate this device or this technique into your daily living? How's it working out? Should we try a different technique? These are all really good questions to kind of reassess as we move forward with a second or a third appointment. You can also remind the individual, because they might be self-conscious about asking for reviews or multiple reviews, remind them that new information will often take multiple repetitions to become something that they can easily access and be able to integrate into their lives. So that's part of what we want to do. We want to provide those opportunities to have some repetition to the new information that we're providing them. As we provide instruction, we want to partner with the learner. This means not just being the instructor providing a PowerPoint at the front of the room, it's being a partner, creating a partnership with the learner themselves. We can facilitate the learning instead of thinking of ourselves as that instructor. And by facilitating, I mean we're giving the learner choices. One example might be that there are different types of check writing guides. So we could set up each one of them and allow the learner to try each one and then select the one that they feel most comfortable using. Or we may have them try different methods for pouring a hot cup of coffee. Instead of just showing them a liquid level indicator to do the task, we could also demonstrate and have them try using contrast, sound, weight, and just maybe they even have another strategy that they have been trying that could work as well. We want to know from them what works and what doesn't work. Part of learning is having those opportunities to fail and learn what doesn't work. I remember before I went to the vision rehabilitation therapy program, I was doing things using certain strategies that when I went to school, I found out were not in the textbook. They weren't things that are well known as strategies, and yet those strategies worked very well for me and were quite efficient. So learning from our consumers about what they're doing, we can even learn new ways to do things, and that builds up our repertoire as professionals. Make instruction self-directed by trying some of these suggestions. Ask the consumer to set up the work area prior to a lesson. This will give the consumer something practical to do, and it will help you to save some time once you've arrived for the lesson. It will also give you an opportunity to assess the ability of the consumer to organize the items that they need for the specific activity. Use questions instead of statements. For instance, you could say, let's turn on a light so that you can see this task better. And I think that it's helping the individual if they are more involved in the decision-making process and helps them think through the problem-solving nature of what instructing them on if you phrase it as a question. So you could say, would it help you if we turned the light on in completing this task? Other questions you might ask include, how did this activity feel now that you've completed all of the steps using the adaptive strategies or devices? What was the hardest part of this activity and why? Asking questions helps your consumer to reflect on their experience, to see what really was challenging, what felt okay, and to help them to continue to problem solve. It's not always a one-size-fits-all, and the first time you try an activity, it might not be the right way for the individual. So asking these questions helps them to verbalize what is happening for them and help you to work with them to figure out the best solution for their situation. Utilize life experience in your instruction by comparing new tasks or strategies to things that an individual probably did earlier in their life. For instance, if you're teaching the grid pattern for cleaning the countertop, you might compare it to mowing the grass. Other things that you might rely on life experience to help you with could be referring to how thick a batter was when they cooked this recipe in the past, or does it smell correct when they're cooking a certain recipe that they're familiar with. If they're organizing their closet and their clothing, which top did you typically wear with this pair of pants? Describe it for me so we can find it and mark it, and you can pair it up again when you want to wear this outfit. Keep learning focused on the goal. This can be challenging if we have a consumer who's a little impatient about moving forward with their instruction, or if a goal isn't turning out in the way that we expected that the instruction would be able to help. So in the first case where we have the impatient consumer, you might say, let's cover a few safety tips and then we can start preparing your recipe. In the case of restructuring a goal because of the individual's needs, you might say, your tremors are interfering with your ability to be able to safely pour your cup of hot coffee. However, if we could use a Keurig instead of the coffee pot, then you wouldn't need to pour the hot liquid and we could avoid the safety concerns we have with getting the hot liquid into your mug. Make learning practical. Some ways you might do this are, instead of just having the individual identify several coins during the lesson, to have them actually count out, say, 33 cents. So adding up the amounts and counting out the proper change. Another idea is to have the individual actually make a cup of hot tea or popcorn in the microwave when you put the marks on so that they can practice pushing the buttons but have a practical outcome for the activity. The last idea is to have the consumer gather their laundry prior to your appointment so that you can start the laundry as part of the lesson. Reinforce relevancy. We learn a lot of adaptive strategies and techniques, but it's very helpful when we bring it back to the relevant reason that we're learning a task. Once you've learned how to thread a needle, we can practice sewing on a few buttons. Or, now that you've learned a few letters in Braille, let's make a few labels to identify some of the items in your cabinet. For instance, we can put a C on a label to identify the cans of corn. Another thing we can do is with a magnifier. Now that you have this magnifier that we have identified will be helpful for you, let's try some different tasks around your home. Let's look at the stack of mail. Can you see who this piece of mail is from? Can you identify if it's a bill or a piece of junk mail? What about identifying these items in the kitchen? Can you see the labels? What about reading the recipe on the back? Can you tell how much oil or water needs to be added to the recipe? Encourage collaboration. Especially encourage it between the individual you're providing services to and their family and/or support system. Some of the activities that they might collaborate on is preparing a meal. The individual will not need to know how to do every single step of a recipe independently if it's done as a group. The group can simply put the individual at doing the tasks that they have learned how to do so far, or maybe the ones that they just feel most confident or enjoy doing the most. Another activity that can be done together is listening to an audiobook. Audiobooks are very popular nowadays, and so the individual with a vision impairment can share their audiobook with their friend or their family members. Another thing that is important is for the individual, once they've lost their vision, to be able to fit into their family or their group of friends. So finding that role where they fit in. Sometimes they don't fit in exactly the same way that they fit in before their vision impairment. So finding that spot and figuring out how they can contribute to the group and still enjoy those interactions within the group, that they can be a valuable member of the group, is important. As we come to the end of our presentation today, there are a few key thoughts that I want to make sure you consider as you move forward in providing services to adults. First, listening is really important. When we listen to our consumers, it helps them feel valuable. It helps build that rapport and that trust. We want them to trust us because they'll feel more comfortable to tell us if something isn't working well for them, and we need to know that so we can help them strategize a new way to do a task if the way that we started out with isn't working for them. We want to inform them about their options, about the possibilities that they have as someone who has limited vision. We have many prejudices and preconceived ideas in our culture about what is possible when someone has vision loss, and that affects people significantly, and we can't underestimate that. Showing them that there are multiple options, not just one way to complete a task, will help empower them to know that they still have choices. It's not like they're locked in to just sitting in the corner listening to their talking books all day. We want to show them the opportunities that they have to live their life to its fullest extent. Motivate. We want to make sure that we have their trust so that we can learn what motivates them. In this way, we can customize the goals to the things that they really want to learn. We don't truly learn about what will motivate someone unless we've built that trust relationship with them. And last, we want to be a partner with the individuals we serve. We want to come alongside them and help them feel safe in the learning process. If they fail, that's okay. We've only discovered one way that doesn't work for them, not the 20 other ways that might work for them. So helping them to know that we're there to help them to continue to problem solve no matter what the situation is for them, what their unique circumstances are and challenges that they have in living their life. For more information, you can check out our continuing education course entitled Strategies for Teaching Adults with Vision Loss. This course is available for ACV REP and NBTCB credits, and there is no charge for taking it.